What is teeth whitening? Teeth whitening is a cosmetic dentistry treatment that improves smile aesthetics. Teeth whitening is popular in today's date. We see it in celebrities, social media influencers, and even people we know. Depending on which way you want to go about it, you could do at-home whitening or professional whitening. With at-home whitening, there are a variety of methods you could do, starting with whitening rinses, which is like a regular mouthwash, except this helps whiten your teeth by swirling it around your mouth for 1 to 2 minutes. Also, there is whitening toothpaste, which help remove the surface stains as you do gentle brushing. There's also the main common ones, which are gel strips. You apply them to the surfaces of your teeth, and you wear them up to 2 hours. And depending on the strength, you may need to wear them for about 10 to 20 days. There's also gel trays. The trays are molded to the shape of your teeth, and you apply gel to them, and you fit them over your teeth for a certain amount of time. For professional whitening, teeth are whitened with using light sources, including lasers, light-emitting diodes, LED, plasma arc lamps, and halogen lamps. Depending on your case, the dentist will recommend the best method for you. With this professional whitening, they use a cheek retractor to help expose all the teeth. Then they apply a liquid rubber dam, which hardens into the gums to protect them. And then that's when they use the hydrogen peroxide bleaching gel, which is applied on the teeth. And they use the light to help brighten the teeth. Even though teeth whitening is commonly done, there are risks to getting this done. Some whitening products contain chemicals that damage your teeth, gums, and even dental restorations like fillings, crowns, implants. Most of the damage that the teeth whitening can potentially cause is only temporary. However, if you use whitening products without the supervision of a dentist for a long period of time, you may experience some permanent damage. Although home teeth whitening can be more economically affordable, it does have its disadvantages, meaning teeth whitening at home can be pretty slow and it does not lead to quick results. It takes a little longer for the teeth to whiten. You use a lot more trays for a longer period of time for more days as well. Home teeth whitening can also harm gingival tissue and teeth, leading to gum and tooth sensitivity. And also, the lower the quality of the bleach is, the more it causes harm, which makes the teeth and gum to be prone to infections that can cause decay. As mentioned, tooth sensitivity is a disadvantage to home whitening, but it's also a disadvantage of teeth whitening in general. Repeated bleaching can cause more sensitivity, discomfort, and pain when eating or drinking cold foods and beverages. Teeth sensitivity can last longer if you over-bleach. Additionally, you may find it painful to eat food that isn't soft. It can become so severe that it can even hurt when you're just breathing air through your mouth. At-home whitening can also cause pain. This is due to the bleach used, which can extend into the cavities and damage the tooth structure permanently. The bleach also can cause damage to the nerves and cause toothaches. Also, in addition to it damaging the nerves, it could cause temporary inflammation of the nerve inside the teeth, which is definitely worse in patients with gum recession and exposed roots. If the teeth whitening gel comes into contact with the nerve of the tooth through large untreated cavities, permanent nerve damage can result, leading to the need for extensive dental treatment, which is not good because this would also lead to the permanent damage of the teeth, and it could cause the pain and discomfort to get worse.
Enamel change can happen by over-bleaching. Excess use of whitening chemicals on tooth enamel leads to a decrease in its microhardness. It can also cause a change in the mineral content of enamel, weakening it and making it more susceptible to cavities. This is where specific ingredients in teeth whitening gels become very important. Many whitening gels are acidic in pH, which is erosive and cause weakening to tooth enamel. To fight this decrease in hardness, many professional teeth whitening products have minerals added to their formulations. These minerals work to strengthen enamel and counteract the effect of the chemicals in the whitening gels. Teeth whitening can cause permanent damage. Using over-the-counter bleaching trays and strips can cause patchy or spotted teeth. Any irregularities in the teeth can cause the bleach to stick in some parts of the teeth. When using over-the-counter strips and trays, one cannot diagnose his cavities. Additionally, these kits can cause pain in the cavities. Whitening a strip can cause stain. Another disadvantage of home teeth whitening is that not all are minor enough to be removed by these kits. That is what causes patches and dots on the teeth. Similarly, these bleaching chemicals can stain teeth, leading to unexpected negative results. In a nutshell, one does not get the same results from a dentist. This is because of the methods used and quality of the bleaching chemicals to cause staining of the teeth. Excessive bleaching can cause gum irritation and recession. Gingival tissue is not as resilient to bleach as teeth are. Gingival tissue can become sensitive, irritated, and inflamed with over-bleaching. Gingival tissue irritation can cause bleeding when brushing teeth, recession and retraction. Also, if you have dental problems such as gingivitis or cavities, you have an even higher risk of gingival recession. Once your gingival tissue recedes, fixing the problem can be challenging. Your dentist may have to perform a soft tissue graft to alleviate your sensitivity. Home teeth whitening can cause chemical burns on gum tissue. High concentration of carbamide peroxide or hydrogen peroxide teeth whitening gels are not safe for the soft tissues inside the mouth. If the gel contacts the lining of the cheeks, lips, tongue, and gums, a chemical burn results. The gums will turn white and blister in a painful reaction to this strong gel.
Some whitening solutions are not safe and cause harm, so you need to make sure that you consult the dentist and only use approved system under professional supervision. In addition, teeth can become smaller as a result of overbridging, and dental erosion has an increased risk developing cavities. What products should I avoid? First, avoid anything containing fruit juice, such as many DIY or homemade teeth whitening recipes. Those are always acidic in pH, and they will weaken your enamel. Second, avoid anything over the counter or one does not get approved by the American Dental Association. The ADA tests products to confirm their safety and their effectiveness. 3. Avoid using professional strings product without the costume-fitted whitening tray. The perfect fit against your teeth of a costume-made tray. Prevent high concentrations of gel from contacting your gums, lips, cheeks, and tongue. Always consult with your dentist about the health of your teeth, gums. After you know that you are free from any active cavity or gum disease, you can begin whitening with over-the-counter product, or you can work with your dentist to use professional product. Over-the-counter product that contain either hydrogen peroxide or carbamide peroxide as the active ingredient will whiten your teeth. Look for seal of approval from the American Dental Association. For faster, better result, ask about the professional teeth whitening. With custom-fitted trees and the highest strength professional whitening gel, you will experience results that are more noticeable in a shorter amount of time. You will also have the added benefit of the dentist customizing and overseeing your treatment. What about whitening toothpaste? Whitening toothpaste are good for polishing away superficial stain. They do not penetrate deep into the teeth, but actually change their color. Some whitening toothpaste are too abrasive and can cause damage to your teeth. Therefore, check for the seal of approval from the American Dental Association to make sure that it has been tested for safety. Do not use whitening toothpaste if your teeth are too sensitive or if you have exposed the root due to gum recession. Consult with your dentist about teeth whitening options that will not cause further sensitivity or root damage. In conclusion, if you go to the dental office for your teeth whitening, you don't need to be worried about the problem like bridge erosion. Your dentist will always advise you. Teeth whitening or bleaching in itself doesn't destroy your teeth. Problem only arises when you do so excessively. The right way to achieve healthy white teeth is to consult with an expert about your options and how often you should bleach them.